First, let me describe what is a prostate gland. The prostate gland is a male reproductive organ, and it's essential for fertility. It sits below the bladder, right at the outlet of the bladder, and contributes fluid to the semen during ejaculation. Now, as a man ages, the prostate stops serving its reproductive function and does give rise to other problems. A more common problem that gives rise to is called BPH, which is a benign enlargement of the prostate, and that causes a lot of men to experience urinary symptoms as they age. But another problem that they may encounter is prostate cancer. Now, cancer of any organ arises when cells lose their function, their normal function, and transform into a group of cells that have its own ability to grow and multiply and even spread to the detriment of the patient, and may even cause harm and eventually mortality. And that's what essentially cancer is of the prostate gland. Prostate cancer can, in its early stages, not have any symptoms at all. In some other patients, it may present with early symptoms of urinary difficulty, such as frequent visits to the toilet, difficulty emptying the bladder, or nocturia, which means going to the bathroom at night to empty the bladder. And in some patients, blood in the urine, as well as complete inability to pass urine. Actually, in our understanding of many cancers, the causation is sometimes not fully understood. And it's quite similar in prostate cancer as well. But we know that there are certain factors that do increase one's chances of getting prostate cancer. Age is the single biggest factor at play. The older a man is, the more likely he is of getting this disease. If you do have a family history of prostate cancer in your family, especially in your father or brother, it increases your risk of prostate cancer by about 2 times. So usually in this group, we would recommend going for screening and early detection. First, you need to discuss this fully with your urologist who diagnosed your disease. He will best be able to counsel you on what's the stage of the disease, what's the grade of the tumor that you detected, and what's the chances that your disease has already spread beyond the prostate and has spread to other places, or is it early, meaning it's only confined within the prostate gland. The treatment options really will depend on at what stage your disease is at. In early prostate cancer, where the disease is completely localized to the prostate, the treatment options are a few. One is radiation treatment, surgery, or what we call active surveillance. Now, for treatment of advanced prostate cancer, is really for when the disease has spread beyond the confines of the prostate. It may have spread to the lymph nodes, or perhaps to the bone, or to other organs. Now, the treatment options in this case is not surgery, but to discuss the use of hormonal therapy treatments. Hormonal therapy treatments are medications that are usually given either by tablet or by injections to reduce the male testosterone levels. And by doing so, it actually helps shrink down the tumor and reduce the complications associated with these tumors that have spread. In addition, where hormone therapy fails, chemotherapy can be used. Prostate cancer is diagnosed by a number of means. First, your doctor will perform a digital rectal examination. That means putting on a glove and feeling the prostate through the rectum. By this examination, you may be able to feel nodules or lumps or irregularities within the prostate gland. The presence of these will then prompt one to suspect whether one has prostate tumors or not. Second test that a doctor will often perform for you is a blood test called PSA. This is called prostate specific antigen. And when this level is above a certain level, the doctor will recommend to you whether you want to consider doing a transrectal biopsy of the prostate. Now, this biopsy is done through the rectum under ultrasound guidance. And under ultrasound guidance, the needle is directed towards the prostate gland to obtain specimens. Now, these specimens are then sent for microscopic examination to determine whether or not there is prostate cancer. Now, upon the diagnosis of prostate cancer, it can be a very troubling time for a patient. And really, the care for a patient has to start right from the beginning. For all our patients, we will have a multidisciplinary team of not just nurses and doctors, but also the presence of a patient support group that's available for them to tap upon if they need a resource of a listening ear from cancer survivors and those who have been through treatment before. And from them, they can get an empathic ear to understand the disease better and to even discuss what the options that are laid before them. The doctors and the nurses also have access to a multidisciplinary tumor board where we convene discussions to discuss complex cases, management plans, together with the radiation oncologists, the medical oncologists, the pathologists, and the radiologists who read all the scans. And together as a team, we formulate plans on behalf of the patients and give them the best possible recommendation